further ado, let me introduce your speakers for today. I'm delighted to be joined by Oviva's. Oh, if I can just ask you to go on mute. Okay, thank you. I'm delighted to be joined by our Chief Technology Officer Manuel Baumann. Sorry, I'm not getting through that. It's because I keep getting an echo from people's microphones. Manuel Baumann, who is joining us. He's our CTO and co-founder of Oviva. I've also got for you Juliet Finnie, who is our clinical expert dietitian for both obesity and AI at Oviva. And lastly, but definitely not least, I have to say, without being rude to our other two speakers, the one I'm most excited about, is one of our patients, Adam. So really delighted to be able to bring in the patient perspective of being on the receiving end of AI-supported care. So before I pass over to our speakers, I just wanted to tell you a little bit more about Oviva. So Oviva in the UK is one of the largest providers of weight management services. We only exist in the reimbursed space. That means that we are a partner to the NHS only and only support NHS patients in the UK. And we have pathways that span the whole mix of services across type 2 diabetes and obesity. So that ranges from type 2 diabetes prevention right through to remission. And on obesity, we have tier 2 obesity, which is much more digital, I would say, in nature, right through to our multidisciplinary team, tier 3 weight management, which also includes the provision and monitoring of GLP-1 medications. Oviva has been around over a decade now. So Oviva UK launched back in March 2015. And across the UK, Germany and Switzerland, we have supported over 1 million patients in our tenure and really proud of the outcomes that we've developed and very happy to have the opportunity to share those with you today. So how do we create long-term behaviour change? I think what's really important to get across is the fact that Oviva is not about delivering GLP-1 medications. And actually what we're really here to do is to provide the best care and outcomes to patients. And that means being multidisciplinary in nature and making sure that those teams work well together and they are there to support patients throughout their journey. And we also have a Class 2A medical device Oviva app. And that's really important because it's there to provide the touch points between the clinical sessions, but it also drives clinical outcomes in its own right because it's a behavioural change tool. So the more adaptive features we can put in there to personalise, the more effective it is for patients. And Mano a bit later on is going to tell you much more about the app as he introduces how we're using AI. And finally, the pathways themselves are quite bespoke to each patient. It's not a one size fits all, and that's really important. So if a patient comes through to us, let's take the tier 3 weight management pathway, for instance, they may be on a lifestyle only pathway, in which case they're supported by our team of dietitians and health coaches, but certain patients will be supported by GLP-1 medications and other patients will be triaged into receiving support from our consultant psychologists. So those pathways are very much triaged to each individual and adapt as they go through the pathway to make sure they are responding to patients' needs. And if we talk a little bit about the outcomes of that service, we've had over 27,000 patients into our tier 3 weight management service to date. At the moment, we're supporting about 8,000 patients each month. We're really proud of our clinical outcomes. So we're achieving an average of over 15% weight loss at a year. And why that's significant is because it matches the clinical trials that have been developed. So these patients have been supported with Wegovy so far, and that matches the Novo trial data, but in a much more complex patient population. So because we are delivering NHS services, these are patients that have many barriers to change. We have high proportions from low socioeconomic profiles, high level of unemployment at around 12 to 13%. Over a third of our patients are living with disabilities when they come through to our service. So the fact that we're able to echo those clinical trial results really speaks to the efficacy of the combination of the technology and the multidisciplinary team. And what's really telling is just how many patients retain on the actual app. So our overall service retention is very high indeed, over 80%. even past a year. But the fact that after 6 months, 80% of the patients that come in are still using the app each day to support and evolve their behaviour change is really telling to the value that they perceive from that tool. Lovely. And if we look at our GLP-1 service, it is a 24-month service. And how it really works is when a patient is referred in by their GP and they're eligible, the first thing we do is we're finding as much out about them as we can. And we do that through a variety of tools, from surveys right through to their initial consultations. And that data collection is very important for us to be able to personalise that service to each individual. Once we've collected the relevant data, what we're then able to do is to develop them an individualised diet plan and make sure that they're on the right pathway for both GLP-1 and non-GLP-1 patients, and that pathway is tracking their progress. If you can just pop yourself on mute for me, please. Thank you. Now, after they're set up on their personalised plan, we then go into a period of coaching, and that's partly through the app-based tools and partly through our... Pop yourself on mute, please. Thank you. We go into a period of coaching partly through the app and partly through our team of healthcare professionals. And that requires really close collaboration, both in between our teams and the referring in doctors, to make sure that we're keeping patients safe, that we've got the most up-to-date information, and that we're really integrated into their overall cares. What we don't believe in is operating in silos from the rest of the healthcare system. So that remains really important to us. And of course, also what's important to us is leading with the right clinical governance and clinical leadership. So I just wanted to introduce some of our clinical leaders. We have our lead consultant endocrinologist, which is Dr. Wasim Majid. We have our medical director and CQC registered manager, Dr. Shane Mehta. And we have a full complement of clinical experts from each of the professions. So that includes our clinical nurse specialist, our senior clinical psychologist, and of course, Juliet Finnie, who is our clinical expert dietitian and joining us on the call today. And I think something just to share is a little bit around our scale now. So we have over 160 dietitians, nutritionists and health coaches that are delivering the services to our patients, a team of over 20 consultant endocrinologists who are leading that MDT. And we have actually around 90 in terms of our prescribing team, including the consultant endocrinologists and our non-medical prescribers, with a large team of specialist nurses undertaking some of that prescribing and monitoring activity. And then just before I pass you over to Mano, I wanted to tell you a little bit about the Oviva app. Let's just allow you to see a little bit of what it does. So if we look at the primary ways that you support someone with behaviour change, it's things like self-monitoring, it's goal setting, it's getting some feedback, it's getting recognition, it's a little bit of gamification through the development of streaks. But ideally, what it's doing is adapting and evolving to you. It's helping you to identify the right goals, tracking your progress against them. What's getting in the way? Then it's going into problem solving. It's really important to note that this is a Class 2 medical device, Class 2A, and it's DTAC compliant in the UK. So it has all the relevant regulations in order to operate within an NHS environment. But I think here's a good moment for me to pause, since we've started talking about the app, and allow myself to pass over to Manuel Baumann, who is going to take you through more about, firstly, why we've developed AI, and then how we've done it and why it's important. Over to you.
Thank you very much for the warm intro, Lucy. We here at Oviva have been working with AI, I would say since the beginning, since more than 10 years. We worked on building our own image models to support our patients tracking their meals better. So I think it goes without saying that serving these millions and more patients in an as efficient way as possible, it is an absolute necessity to use technology to its fullest potential. Also, we do think that ChatGPTs and the like do, increase the offering for our patients, and we want to stay at forefront with the technology and support them on a daily basis. But this is why we always have and always will put AI as one of our core strategic parts that makes up our product. And today I'm going to show you through through like one of the journeys the patients experience in their product. But before we do that, we didn't just start slapping AI on everything. We did start with consult the experts we have in our network. We do have a lot of experience with building safe and secure devices and use all that knowledge before even starting. Now, on the next slide, we see our primary use case we serve in our app. This is mainly about patients being able to reflect on their behavior. And this whole journey starts on the left side by snapping a picture of a meal. This picture is then automatically transferred into a description. And so it lists up all the ingredients. And once a meal is saved, we then provide a high-level summary of the macros on that meal. So while this is not perfect on the gram all the time, it does give a good guidance to patients to have insights in their behaviors. But I think that insight in itself does not help enough if we cannot go into details. That's what you see on the right side, is we can break down and show that what is high in carbs, what is low in protein, where is fiber, and so on. And even here, we're not done yet using AI in our product. We also then, on the next slide, see the tips. We can show how to improve, what to replace, what to think about maybe buying next time in the grocery shop, and kind of what to approach differently next time. And then last but not least, on the right side, this is something we have in development, is to have directly a live discussion with our AI companion we call Auri. Now, Auri aims at supporting patients 24/7 with things like personal preferences, right? If the tips point towards Greek yogurt, then let's just ask Auri if I don't like Greek yogurt, right? So we can offer an in-depth personalization that is available all the time. Furthermore, Auri also supports with overcoming daily issues. For example, that a patient sees that meals over lunchtime are usually unhealthy, and then Auri can support into how can we plan for improving that next time. Now, on the next slide, we also see that, be there yet? Yes, here. Although Auri lives in the chat, we do offer a lot of hooks into that conversational experience. So Auri can go into details, as I just described, into meal feedbacks, but it can also discuss recipes and how to replace some ingredients there. But it can also help if, for example, the weight is plateauing, and how to think about this and not to be too nervous about it, and how to get back on track. Now, in the vision, how we think about Auri, that's on the next slide, is we can offer a companion, and we call it the AI companion, that is always there. That's our main goal. Because for some questions that today patients ask, they need to wait for some time until they get a reaction, because we have limitations in terms of growth, we have limitations in terms of opening hours, so we cannot always be there for the patients, and this is what we want to change. So the way how we think about this is not replacing the human part of our care, but to augment it with a real-time component that allows to support with so far simple things, but at least real time. And the way how we think about this is to have then the human healthcare professional supporting with special situations, special cases, special needs, and also supporting with motivation. Then maybe a little bit about how we approach building the systems is on the next slide, we see then roughly what roles we bring together. So we not just have engineers working on that system, for example, we do have a multidisciplinary team which works towards the goal to have a safe and secure product on the market and in the hands of our patients. So overall, we combine clinical quality experts, but then also behavioral science, and that's Juliet who will speak just after me, and along with engineers who build that technology at the end. And these three roles come together to assert that we build both a safe but also an effective product that serves the needs of the patients. On the left side, we do have many different certifications. So we are, as Oviva, are a certified manufacturer of medical devices. We do have multiple medical devices in the market. We are certified in terms of cybersecurity and also from an app-specific security certification, which is, I would say, at the standard of banking apps. So to make sure that no data leaves those devices and is protected to the most up-to-date standards there are. Then we also have DTAC, CQC registration, and then also Cyber Essential Plus, which all support to have safe and secure treatment on a daily basis. And so I hand the microphone back to Lucy. Thank you very much.
Thanks so much. Really interesting. And just to reiterate, if you have any questions for Mano, and these could be very broad about just, you know, the technical setup of how to build these AI prompts and AI coaches, or whether it's around team structure and the challenges on that, please do add your questions into the Q&A and we'll make sure we come to them at the end. But without any further ado, we're going to pass over to Juliet, who's going to talk us through a little bit of the clinical effectiveness. How do we make sure that the AI tools that we're developing actually do good for our patients? So over to you, Juliet.
Brilliant. Thank you, Lucy. So I'd like to talk first of all about how we can make our interactions with our AI supported technology as meaningful as possible to our patients. And what we touched on earlier was the example of ChatGPT as an alternative for our patients. And what we would like our patients to do is to choose to interact with our app. And we need to make that choice really meaningful for them. So rather than if our patient's looking for breakfast ideas, for example, rather than going to ChatGPT and asking for a list of breakfast ideas, how can we make it a much more personalized and meaningful experience for our patients? And part of that is using real-time patient data to support the conversation. So you've seen some insights into our app already, and you've seen that our patients can log a range of different metrics on the app, from their weight to their mood, how they're feeling today, any symptoms they're experiencing, and then other metrics like their blood glucose levels, for example. And people will choose what is relevant to them and log the metrics that are relevant to them and their goals. But it may be that they've logged their blood glucose level this morning, and when they're asking for breakfast ideas, that we can bring that into it and suggest an appropriate breakfast depending on that result. It may be that we can suggest breakfast ideas based on their previous preferences, or based on a conversation that we had yesterday, that our AI can then draw on to then carry on the conversation and feed into what changes a patient's already made based on that as well. So by feeding in all of the relevant data and the history that we have from our patients, we can make that conversation with our AI companion really meaningful, really contextual, and feel personalized to the patient. And I think that's how we contain that within the app and make sure that our patients are able to make use of all the different functions within the app as well. When we are supporting our patients to make best use of the AI technology, we want to use behavior change techniques in order to do that. And our app at Oviva has been built on behavior change theory. So this isn't new to the interface with AI. Since the very beginning, our technology was based on behavior change techniques. Just ask anybody who's not on mute to please mute themselves just now. Thank you. So we're well experienced in building our technology based on behavior change theory, and there's no difference now that we're working with AI in doing that. And it's really important that we're using AI to work in partnership with behavior change approaches, and that's where we can translate or switch from an interesting conversation with AI to something really meaningful, which is really supporting people to actually make real behavior change, make real health improvements as a result. So we use a variety of different approaches to do that. So we can look at the COM-B model, capability, opportunity, motivation, and we can discuss with our patients which of these are your particular challenges, and then we can tailor the support that we provide within the app and within the messaging to our patients, depending on what elements of the COM-B are particular challenges for them as well. We can look at timings of nudges that we provide for our patients. So if we know our patient, we know the data, and we know that if it gets to 5 p.m, they're not going to fit in their daily walk, can we time those nudges to remind them to do their daily walk before it gets to 5 p.m, before it's too late that they miss it? And feeding the data into the AI allows us to have all these opportunities. We also look at incremental improvements. So we saw, Manuel showed you the example of the patient logging their breakfast there. And rather than us going back with a suggestion for a completely different breakfast, we can make an incremental improvement to that. So we could support our patients to add a little bit more fiber to that breakfast next time. And the benefit of that is we can then close the loop the following day. The patient goes back and logs the breakfast the next day, and then we can feed back that previous conversation about increasing the fiber yesterday. Well, how did we do with that today? Did you manage to increase the fiber? And then what's the next incremental improvement that you can make? And finally, we've got the opportunity to have longer, deeper motivational conversations with our patients. And this is something that our human coaches are fantastic at supporting motivational conversations. And sometimes the time is limited that we have to have those really long conversations about exploring all of the barriers someone might be experiencing, the pros and cons of change, problem solving, finding the different solutions to problems, choosing a solution. You essentially have unlimited time to have that conversation with an AI companion. So it allows those deeper conversations that can then feed into the human coaching at a later stage as well. So continuing to support that behavior change theory is really important for us. And just to go into a bit more detail on some of those topics then just now, we've mentioned targeting support at the right time to our patients, but we can look at not only just that individual day-by-day case, but actually looking at patient groups as a whole. We can look at all of the data around that and identify times where we know that our patients might be at risk of lapse or relapse or dropping out, by saying, this is a key time where we know patients might experience a plateau, or this type of patient might experience a plateau based on their demographics. Then we can target those patients with the right support at the right time to try and prevent that. So we want to be there with them before problems occur, and we've got all the data to help us to understand that now. Often people need support most when their motivation is lowest, when they're really struggling, and that might be the time when they don't want to reach out to us, or their motivation is too low to reach out to us. And by using our AI to identify the points when people are struggling, using the trigger points where we can identify that they're struggling, we can reach out to them and be there for them when their motivation is lower, and help to bring them back. There's also a need, I think, for that live support in the really challenging moments. So Manuel also mentioned, the case where you don't want to wait for 24 hours for a human to get back to you. Actually, if you're experiencing a craving right now in the moment, you've got the opportunity to chat that through with the AI companion and to talk about approaches and to talk you out of going to the fridge and to find an alternative comforting activity that you could do. And it's right there in that moment that patient needs that support. Also, there's so many other opportunities in that live support situation, such as choosing items off a menu, or if you're just really struggling with that motivation to get yourself out of the door to go for your daily walk, having a quick motivational chat could make all the difference. So we can see a huge opportunity in those live support situations. But we don't only want to limit our support to patients who are struggling. We talked a lot about identifying those key points and being there to support patients who are struggling, but actually we want to be there to support and encourage our patients who are doing really well and create that positive loop of behavior change as well, and to drive further healthy behavior change too. And again, we can target the support to help to our patients who are doing really well too, and to achieve the best that they're able to achieve. So with all of those opportunities also comes a responsibility for us to make sure that our clinical care is both effective and safe, and the safety of our patients is our absolute priority. And so when we're training our AI models, we're training them to act as expert healthcare professionals, and also to use behavior change based on evidence-based behavior change theory. And what we want them to do is act like a top clinician, an expert clinician with all of the output of our AI models. So we want to train them to work using only evidence-based practice and using appropriate clinical guidelines. So that's our role, to make sure that that's the way our AI works. And then we need to check that that's what's happening too. So there's the final part to that is making sure that we're checking the output. So all of the interactions that our patients have with AI, we need to check that. And we can use technology to check that, but we also need to have humans in the loop for that checking as well, is absolutely essential. And we can check scenarios too. So not only later seeing what the conversations are with AI ahead of time, we can check specific safety scenarios, different clinical scenarios, check how the AI responses, and adjust the training to the AI model around that too. So all of that is fundamental to our approach with AI, and essentially what we want to do is have our AI acting as that safe clinical expert. So I'm just going to cover two more slides, and these are both around data and what the data that we gather and what we're learning so far about the impact of AI. So at Oviva, we are collecting more than 7 million data points every day, which is an astounding amount of data and really incredibly insightful. And all of the input that our patients are logging on the app really helps to build that knowledge. And we can then use that to really personalize that care to our patients. So that's the most important thing, is to do with that data, is to personalize the care to the patient and use that to support them to achieve the outcomes that they're hoping to achieve. So when we've used retrieval augmented generation, or RAG, where we're feeding that previous historical data into what the AI is doing, we've seen that when we do that to draft messages for our coaches to check and then send, we reduce the amount of time that they have to edit the messages. And the reason for that is, if you're feeding in the history of the previous conversation, of the patient's meal logs up until now, you can generate a really personalized message that a human coach can come in and check and then make some edits to personalize and then send. But the number of edits they need to make is far fewer if all of that information is fed into it, and you get a really great quality of message. And often better than the human would be able to do alone, because they can't potentially look back over 24 months of messaging between the patient and the coach to bring all that context into account. Similarly, we saw when we looked to improve the macronutrient estimations of our AI meal assessment, that using RAG helps to improve the accuracy of that hugely. And the more we do this, the more we learn, and the more data feeds in, and the more accurate it becomes. So that becomes, again, another really positive cycle. And then finally, I wanted to look at the outcomes that we are achieving, or that we've seen so far when we've implemented AI-based technology in what we do. So we've looked at that nutrition loop of the meal feedback, instant meal feedback that our patients achieve. And what we saw was a 20% increase in daily active users when we introduced that. So we're seeing that our patients feel this real benefit of being able to log their meal, not wait for feedback on that, but receive that instant, in the moment feedback on what's really good in their meal, what good protein sources they've got in there, what they could work on, how they might increase their fiber next time. It's right there in the moment when they want to see it, and that really drove that engagement with the app, which was great to see. Similarly, when we introduced AI-generated meal plans to support our patients, we saw an increase in our NPS, so patient feedback scores there as well. So again, indicating patients really value having that instant meal plan that they can then act on and make adjustments to as well. We saw an increase in retention at week 12 when we introduced AI-generated weekly summaries. So these were really personalised weekly summaries of a patient's progress over the last week, which encourages that stop and reflect point, and then so it encourages our patients towards goal setting for the next week as well. And again, we saw the value in that with increased retention when we introduced those. And then when we think about efficiency internally as well, we know that when we introduced these AI drafted coach messages for our human coaches to check and then send, it really increased the efficiency of our coaches. And we have some absolutely wonderful coaches with amazing clinical experience within our teams at Oviva, and we want to make best use of that experience and that expertise that they have. So it's, as Manuel says, it's not about replacing the human coach, but it's about helping them to work efficiently and also be able to use their expertise in the right place. So rather than using their time typing out a message, we can draft that message and then they can add their real details of their clinical expertise into that message. So it allows that efficiency, but also better ways of working and better use of clinical expertise. And then finally, we're able to solve patient queries around customer support much more quickly with a chatbot as well. So again, seeing really increasing efficiency in our team with that. So lots of huge different opportunities, but each one so far seeing really good outcomes. So with that, I will hand back to Lucy to introduce Adam, who I think we're all waiting for.
Thank you so much, Juliet. Really interesting. And to everybody, thank you for all the questions that have been flooding in. They're fascinating. I'm looking forward to getting to them. So keep them coming. But before we do that, I'm delighted to welcome Adam to the webinar. Thank you so much for agreeing to come and talk to us all today about your experience.
No problem at all. It's lovely to be here. So yeah, no, I was just, I've had a fantastic experience with Oviva. I've really enjoyed it. I was a bit nervous at first using a digital app. I was wondering how meaningful would it be? Would it be personalized, or would it just be kind of feeling like talking to a robot, or just kind of giving really generic advice? And it's fantastic. It's got such a range of features. I love how holistic it is. So it's not just about the literal eating of the food and how it is. It's also, you've got food psychology in there. It ties in with learning. I also really like how the AI is fantastic, how I can take a picture of my food and it immediately analyzes the different levels of nutrients and gives advice on it. Yeah, no, I think it's been really fantastic so far.
That's great to hear. So it sounds like initially you were a little bit dubious about coming in, but it sounds like that perception has changed over time.
Definitely, yeah.
So tell us, of the kind of features, whether they are AI supported or not, what do you find most helpful in your day-to-day life? What are the kind of functionality or features that you find really supportive to maintaining your changing behaviours?
Yeah, what I really like is how it seems to seamlessly mold together the AI element and also the personal human element with the clinicians. So I feel like I've got my own nutritionist at my side whenever I'm taking a photo, and then the AI tells me how it is, and also all the nudges. I can personalize it, set up my own nudges and goals. And set what time there is. But at the same time, I get regular check-ins with nutritionists and health coaches who have access to all that data. Because something I've found frustrating previously at a more traditional face-to-face NHS weight loss intervention is that they don't really have as much data on me unless I physically write food diaries, and then they don't have time to review it. So either I have to sort of re-say everything, or you just don't have access to that data. So it's really helpful. It takes some work off me that the health coaches and nutritionists can see all this information already and in live time kind of update me.
That's really useful to understand. So actually, it's the continuity piece and the fact that you're not having to start again and to carry it through into repeated conversations with different healthcare professionals. The fact that it's there,
Exactly.
everyone can access it, see your journey. You find that everyone would find that helpful, right? Not having to repeat yourself and start again, and just know that they've got all the data. And from what you were saying on the functionality, then the key things that have helped you is being able to plan ahead. So use the goal function to track what you're doing and to get the kind of recognition and reward for tracking, but then also
Definitely.
the feedback element, which is primarily through the AI. Is that right?
Yeah, definitely. It's primarily through the AI, but then supplemented. I've had wonderful food psychologist calls. So we've gone to really deep about the psychology of eating and triggers, things like that. And again, it integrates really well where the food psychologist spaces out the sessions depending, I think you get 6 or something. So I've had 5, but now I'm having the 6th one months later just to get the full kind of benefit. And also, but yeah, primarily day to day, it's all about interacting with the AI, and it even analyzes if I haven't been a while not using different modules, learning modules that I can then, it says, why don't you have a look at this? Or we think this might be useful for you. But at the same time, it also works really well because it also analyzes and suggests some live webinars for me to attend. So that's really nice because I can attend something live, bit of community feel. You get lots of other people's questions and things. So I really like that you haven't lost the human interaction and sort of the community feel with others as well. Yeah, I think that's fantastic.
Thank you so much, Adam. So it sounds like actually, from your perspective, it's the real mix of offerings, functionality, being able to have your human coach know they're there, being able to access the instantness of AI, but also being able to access broader community. It's all been important for your journey. Is that fair to say?
That's exactly it. And you were saying earlier about gamification. I think that really is useful as well. I think subconsciously we kind of respond to it. So having things like streaks or seeing the visualizations of how much fiber you've been having, stuff like that does help. It also helps in kind of modern life, having it just as an app. It's just another app that you can use regularly. It's very seamless. And I really like how you can see Oviva's always developing. So there are always new features coming. I can see they kind of pay attention to suggestions. We have various surveys to fill in. I can see how it went from previously the AI generation was saying, I think, high or low, just giving more less specific. And now there's a fantastic kind of gradient of a level meter for each thing. So I really like seeing the kind of developments, and it's very exciting to see it kind of mold and grow and be even more tailored to help.
Love that, Adam. And actually, you beautifully given an example of how we iterate the AI according to its own limits. And there was a rationale for doing that initial thing, which was where we were increasing accuracy. We didn't want to give inaccurate data. So you work with the functionality that you've got. And this is really the dynamic between having the clinical safety team, the behavioral science team, and our engineering for the technical integrity. But thank you so much for sharing your experience. I've loved having you here, and I'm sure questions will come through, and we'll make sure that you're included in the answers of those. Before we move to the questions, everyone, I just wanted to wrap up because we've obviously heard a lot over the last 40 minutes. And I think it really comes down to 3 main things. The first thing that we heard from Mano is that this isn't a gimmick and it's not really an option, but it is going to be a necessity in order to scale chronic disease care to the millions of people that need it. Our traditional ways of healthcare coaching just aren't going to enable us to scale to reach all the people that are in need. So it is a necessity. We do really need to think and about how we transform the existing services to make use of AI in the best way for our broader patients. The second is that it can't just be ChatGPT. The safety and the regulatory components have really got to be the core foundations of how we develop this, and having this triangulation of a multidisciplinary team between clinical expertise, clinical safety, technical integrity. That's really how we can develop both something that's effective, but also have the right catch to make sure that it's safe and it's not veering outside the tram lines of what it's been guided to support patients with. And then the third thing is just, you know, the data that have shown us just the impact that it can have. I think that data has been shared with us both from Juliet and from Adam in terms of how it can drive better patient experience, allow people to feel that the service is there at the moment that they need it, that it can help with scaling workforces and really allow us to save the human clinical time for the moments that they're really critical for. And that's all we want to do, is to utilise our healthcare professionals to be at the top of their operating licence and to input the most impact that they can have. And I'm really excited that that's what AI is allowing us to do. So if you would like to refer any patients into the Oviva service, you can see the link for more information on our website, and the 3 modes of how we can accept NHS referrals are on here. Before we finish, I would love to just jump into our Q&A. We'll get a few of these done. I do appreciate time is running short. So if anyone does have to dial off, don't worry. As I said, the full recording will be sent out to you. And we're also going to post the response to all of the questions on the Oviva LinkedIn page. So you will be able to access any answers that we don't get to today. But going to the questions themselves, the first one I'm going to direct to you, Mano, because it is really about the setup, which is how do you regulate the AI and the information that it's providing to ensure that there are no anomalies?
In general, the way how we think about this one is, if you look at an LLM that people might know, like ChatGPT or Gemini, is that it's a generic tool. So I can ask any question and it will reply anything. And the way how we approach this is flipping this around and build it in a way that it only knows about a discrete set of topics. And if as soon as something falls out of those topics, Auri will just feed back that this is not a topic it can discuss, and also refers to please discuss that matter with your healthcare professional. So this is the fundamental approach that we take. In general, on making sure then that whatever we reply to sticks to the best guidelines, is that those topics Auri can talk about, that this is kind of grounded into the clinical knowledge that our team brings into that system. Now, overall, once that is done, there is a lot of testing happening. There is also a lot of spot checking happening in terms of like what happens if somebody writes something odd or in a language it doesn't speak. And there is also a flagging mechanism. So both so the patients can flag messages, but more important, there is a built-in escalation mechanism that directly intervenes and says, this is a topic I cannot talk about. I mean, the general topics, for example, are if there's an issue that is more urgent, like an emergency, like an accident or self-harm. And in all these cases, we automatically then reply to, please seek help from the healthcare professional if it makes sense in terms of like being timely enough, or seek help in emergency services. So there's, I would say, multiple aspects to it to assert that we build a safe product.
Thank you, Manu. I love that in particular because I feel like you've answered one of the other questions on here, which was about how do you ensure that it kind of stays within its tramlines and doesn't provide medical advice. So thank you for answering that. But the second part of that question, which I'm going to throw back at you, is do you have plans to register Auri itself as a medical device outside of the Oviva app?
From a technological perspective, that is a possibility. It's not a clear plan at the moment, right? But it could be an option for Oviva going forward, because if we show that we can build these sort of products, we can technically also bring them into different kinds of treatment overall. Yes.
Brilliant. Thank you. This next question I'm going to bring to you, Adam. So one of the questions has come in about feedback from patients that have perhaps had experiences of tier 3 or obesity management programs that have been delivered more traditionally face to face. Is that relevant to you? Had you had that
Yeah.
experience before? And in which case, what's the key difference? And I feel like you're the best person to answer this.
So the key difference, I had experience with a local hospital, and firstly, the referral process was so much easier with Aviva. I just talked to my GP, and Aviva could also help saying what I need to say to my GP. It was pretty seamless, and they kept me really well in touch with what the waiting list is. It was all pretty quick, and I really liked. I just liked I had someone to go to, and the GP I think liked it as well. Thought it was very seamless. Previously with the hospital, it was firstly nobody really got back to us. Didn't know who to chase. Then I think 3 appointments were cancelled, but they wouldn't say why. And it was only when I went to, I think it was called PALS or something like that, then there was some progress. And then when I did eventually go, I managed to see someone for, I think it was 10, 15 minutes. Hadn't read any of my history or anything that they'd asked me to send, and gave very generic kind of advice of printed off some things from the NHS website, which I've seen and I can do myself. I don't really need advice for that. And then was unclear about what the next steps were or time spans or anything like that. Just said, off you go and let's see what happens. So yeah, it felt that is not very supportive, and I don't really see how we can have a good outcome in that way. Whereas Aviva, I feel like there are plenty of people around me. There's always somewhere to go for support. I feel I know the goals well. I can plan out in my mind where the next steps are, what the next step is, and yeah, a completely different experience.
Thank you, Adam. Really, really interesting to hear that from the patient perspective, far more powerful than anything we could have said, I feel. I'm going to do one more question because I am respectful of everyone's time and I don't want to run too much over. But as I say, we will collate all the others and answer them in LinkedIn. But the final one, I want to come to you, Juliet. We've had a question around the length that the app goes to in terms of giving the patients view of the calories of the meal that's been logged in the app. So do we show calories, and do we show them the total calories or protein intake per day according to their weight? So I wonder if you can talk us through the kind of nutrition information that's displayed back to the patients in the app.
Yeah, it's a really great question, and one that we're often discussing. So at the moment, we are not displaying calories directly to our patients via our nutrition compass, and we saw some insights to the nutrition compass earlier. But the reason why we don't do that is that we often find that when we focus directly on calories like that, it takes away from the focus on nutritional quality. And our focus is very much not just on weight loss and on counting calories and reducing calories, but actually improving health and improving the nutritional quality of what our patients can achieve. And often what we find, particularly with patients on weight loss medications as well, is that their appetite is often much smaller, and often the calorie reductions are happening anyway. But what they really need to do is focus on making sure their body's got the nutrition that they need to stay healthy. So we take a focus on protein and fiber particularly, but we do look at the other macros as well. However, we do provide more general support through our Auri chat, which your patients can ask questions about calories and why we focus on nutritional quality and some of the more general aspects of that too. So we can still personalize that to people who want a bit more information about the background to that and the history of it as well. So I think that's really important that we take that overall view to focus on health, and the more we're adding more and more detail. So you've seen the example of that, as Adam mentioned, he's already seen the change in it just going from high to low to being able to have that really focused feedback, and we'll be able to add more and more feedback to that over time as well. So this technology, we're evolving this all the time, and I think the direction it's going to go in, rather than providing the calorie advice, is to provide a really personalized advice to the patient. So to be able to work out exactly what someone's protein requirements are and provide that really exact feedback on that. Or if somebody wants to focus on reducing their carbohydrates, we can provide that really tailored, personalized support around that too. So that's the direction we want to focus on: overall health and personalization.
Thank you, Juliet. On that note, I'm going to bring the webinar to a close. Apologies if we haven't made it to your question. We will post it on LinkedIn. As promised, we'll send the recording out to you after today as well. A huge thank you to my speakers, to Mano and Juliet, and of course, Adam. And a big thank you to you all too for joining us on this slightly sunny Tuesday, and wishing you a great rest of your day. Thank you, everybody. Take care.